When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Okay, let's kick off the third hour with an interesting story here about how Montreal's wastewater, and could it be used to track the next wave of COVID-19? Dominic Frigon is on the line, professor in the Civil Engineering Department at McGill University. Dominic, how you doing this morning?
Good morning, Elias. Very good, thank you.
Amazing. So, when we're talking about Montreal's wastewater, we're talking about the pee water and the poop water. That's what we're talking about.
Everything you flush down the toilet.
Okay.
In fact, you're flushing down the toilet. A lot of information that we can actually use to track pandemics.
Okay, so I love this. I love this thinking here. Tell me about this project. Tell me how it got started, and tell me what you hope you can decipher from Montreal's wastewater.
So I guess the first goal is to first detect how the uptrends of the virus in the wastewater, which would correlate with the uptrends of cases, right? So we are at the end of the first wave right now, and then we're all worried about the second wave coming up, and we want to detect it. We also know at this point that there's a lot of people that do not develop symptoms. So if we wait for symptoms to develop to go be tested, we won't detect these people. There's also a number of people that would carry the virus and be contagious way before they develop symptoms. And what people around the world, researchers around the world have noticed is that the viral load in wastewater actually increases faster than the number of cases that can be detected. So we're actually hoping to do the same thing in Montreal and also throughout Quebec and Canada. So we have a number of researchers, about 11 in Quebec, that are working on this project and trying to make it not only for Montreal, but for the entire Quebec. And we're also in collaboration with a number of researchers across Canada that are trying to do the same thing across the country. So that's first detection and information to public health. That's really the first goal.
Well, let me tell you, Dominic, you have certainly piqued my interest here. Dominic Frigon is on the line with us. He's a professor in the Civil Engineering Department at McGill University with this research being done now on using Montreal's wastewater to track the next wave of COVID-19. Dominic, you mentioned how they're doing this in some other cities. Can you tell me about your research here? And, are you storing the water from, let's say, February, March, and comparing it? How does that actually work?
So we've been going to wastewater treatment plants. Some students in my lab have been sampling on the South Shore, and people in a collaborating lab at Polytechnique have been collecting samples at the Turcotte wastewater treatment plant in Montreal since mid-March. And so we will have a good archive of this first wave, and that will be used to calibrate our methods. To come up with the protocols to really follow the potential second wave coming up.
Now, I would imagine it would have to be a substantial outbreak to be detected, or can it be just a few people and the testing is so precise? How take me through that and
right. Well, so the science is obviously very young. It's not a new idea, but really developing the full-fledged science where we're at right now is fairly young. There's previous experience in tracking polio resurgence, and there were cases in Israel, for example, in small migrating populations that were detected, and they could go and vaccinate for eradication of polio. But specifically here, one of the countries that had a lot of experience with the detection of viruses in wastewater is the Netherlands. And the early study somehow suggested that we could probably detect one case in about 100,000 people.
Wow.
So a fairly good detection level.
Wow, Dominic, I was not expecting that. That seems pretty incredible. Wow, I'm stunned. 1 in 100,000. That's
One in
pretty
a hundred
incredible.
thousand.
Um,
And then,
yeah, go ahead.
yeah, I mean, and then you can start doing a number of things. So in Italy, for example, they went back to wastewater samples that were archived even at the end of last year, and they went back and in some regions they detected the virus in their wastewater as early as last December. So
Wow.
it gives a totally different outlook of the onset of the epidemics. If you remember, we kind of thought, there was a rapid spreader event, or person, that contaminated a lot of Italy, creating this very rapid onset back in February. Well, maybe the virus had been endemic for much longer than that, based on these results as well.
Wow. Dominic, here in Quebec and you saw you like everyone else, you probably saw the lineups for testing yesterday, after public health told anyone, hey, if you've been to a bar since July 1st, go get tested. And then we saw massive lineups of people trying to get a test. Has there been any analysis, let's say over the last few weeks, that we can look at and say, oh my goodness, we predicted this?
So, unfortunately, no, not at this point. So, Quebec, as we all know, has been quite a bit impacted by the number of cases, and the research labs, like most of the businesses, have been closed down. So in a sense, we're behind the curve a little bit in terms of calibrating our methods in the lab. So our lab and the lab at Poly, we're just starting to really get our techniques up and running right now. So it's still going to be a few weeks before we can actually run full-fledged analyses of the wastewater.
So those are your next steps then would be that ramp up and getting ready over the next few weeks?
Ramp up and getting ready, and developing parallel techniques as well. I mean, one thing that we're very excited about is we wonder, the scientists wonder, why is it that some people develop a stronger version of the disease than others? Well, maybe part of it could be due to the nature of the virus. So we could potentially know what lineage of viruses circulate in the population more accurately by wastewater if we can recover all these RNA sequences from the wastewater. So there's a slew of different information that we can hopefully get from wastewater as well.
Dominic, you know why I appreciate scientists and researchers and people involved in this field? I appreciate them because they can look at poop water and say, no, that's data. Let's do something with it. And I certainly appreciate it. Thanks so much for coming on the show.
Great. Thank you. Thanks for your interest.
That's Dominic Frigon, professor in the Civil Engineering Department at McGill University. And just amazing what you can do now with proper science, proper data. Awesome.